Welcome back to Good Day Orlando. In your Consumer Corner, Republican lawmakers working to create the right plan to replace Obamacare. That's right, but new legislation being introduced has touched a nerve for some people because it could charge older Americans more money. Certified Financial Planner Joe Bert joining us this morning to explain. Joe, good morning.
Good morning, Andrea.
I feel like you need a flow chart for a lot of this stuff just to figure it out.
So it keeps flowing.
Yeah, it does keep flowing, but the flow could stop if we don't have enough money in the system, right? Sure. Let's talk about this proposed new legislation. What does it mean for older Americans?
Well, it's House Bill 708, and what they're looking at is charging older Americans more for their health insurance, simply because older Americans are more likely to use it, and when they use it, it's going to be a lot of money. So it's House Bill 708. Once again, it's just a proposal. We don't know what's going to happen. The bottom line is if they do that, it's going to raise it for about $250 per month or another $3,200 per year. Going to bring the total bill for some seniors up to $18,000 a year for health insurance.
Is it just because there's not enough money going into the system from the younger people who are supposed to sign up?
Remember on the ACA, the idea was that the young folks would sign up for insurance, and because they don't use it, they're paying into a system that they don't use to cover the cost for the older folks. Well, what we've seen is the young folks say, forget it. We don't need it. We're not going to buy it. We'd rather spend our money on vacations and big screen TVs and cell phones.
Why not? That sounds like much more fun.
Limited budget if you don't. And then, so what's happened is the whole thing has fallen apart. And as we said earlier in the break, is that the IRS now is saying, forget it. We're not going to penalize you. You don't have to answer that question on the tax return.
No longer mandatory.
No longer mandatory. Exactly. So it's a difficult situation.
So it's like a pyramid scheme in the way that, you're supposed to have...
I'm not sure I'd call it a pyramid scheme.
I know, but I guess,
right.
When you're sort of dumbing it down, when you're looking at it, you've got some people, more people paying at the bottom that probably aren't going to be using the product.
That was the idea.
To the older people who will be using the product.
See, the government never understood human nature. I mean, you can't afford, and this is where the whole rub comes in. You're forcing people to buy something they don't need. Where does it stop? Where does the Constitution say that you need to buy this product so the older people can have it? And this is what the whole change in health care is going to be. This is the biggest problem I face as a financial planner in doing financial planning for clients that are at or near retirement, that have perhaps lost their jobs. They're not quite eligible for Medicare at age 65. You have this gap. You have COBRA for 18 months, and then you have this gap to pick up your health insurance, and so they go on the exchanges or try to find something on the outside, and this is what's going to impact them the most if, in fact, this happens.
Okay, anything we can do at this particular moment as we prepare for either, buying the insurance or putting away for retirement?
Yeah, keep your fingers crossed.
As simple as that, and that doesn't cost you a thing.
And hope you don't have arthritis to be able to do that while you do it.
All right, very good, Joe. Where can people find you?
Just Google me, 2 words, Joe Bert, B-E-R-T.
Okay.